If you were in need of emergency medical care in Edmonton Wednesday afternoon, average hospital wait times were over 3 hours. But take a look at this. An ER doctor sharing wait times in the middle of last night, as high as 8 hours at the Royal Alexandra. Dr. Raj Sherman calling it a miserable evening, needing to apologize to patients because there aren't enough staff. Alberta Health Services says they're extremely concerned about increasing numbers of hospitalizations due to COVID-19. But for patients, it's also a question of wait times for ambulances to get to the hospital.
An hour wait for a paramedic to come walking through your door is an extremely long time and has a significant impact on the outcome of your disease process.
The union representing a large number of paramedics has been sounding the alarm for weeks about the alarming frequency of code reds when there are no available EMS in Edmonton at a given time, leading to calls for paramedics from surrounding communities to respond.
There's been 2 occasions that I am aware of, and there are probably more, that Lloydminster has been dispatched as the closest ambulance to a call in Edmonton.
Yes, you heard that right. Ambulances called from communities over 2.5 hours away to medical calls in Edmonton. AHS confirming to City News wait times are up in recent months, but they continue to get to the vast majority of calls in time. But the union is concerned about staff burnout and sick leave due to COVID as we head into a new wave of Omicron patients, seeing an increase in days where there are more calls to 911 than staff are able to answer.
Disconnect or hang up on this caller to pick up the next caller because the volume is so high, which means they don't have enough communications officers to answer the calls. We don't have enough paramedics to respond to the calls. And this is directly a look at the healthcare crisis we are facing in this province, because it's not just EMS. This transcends right into the hospitals.
AHS bracing for increased pressure on the system, saying just like they have adjusted in previous waves, the current projected need can be met. But those on the front line wonder at what cost, with one simple request for everyone.
I need our average Albertans to stay safe because I don't know if we can get to you on time anymore.
Asking to be safe, mask up, and be patient with staff if you need medical help. In Edmonton, Carly Robinson, City News.